Hello everyone, I am Dr. Abdulla Askar Babu, a specialist general surgeon working in Shifa Jazeera hospital. And today I would like to talk to you regarding a common surgical condition that we encounter in day-to-day surgical practice, which is hernia. Now hernia is derived from the Latin for rupture. So it's basically a defect in the abdominal wall through which inside of the abdomen tends to protrude through that defect to the outside. So based on the location, it can be either anywhere in the abdominal wall when it's called as a ventral hernia. It can be through the umbilicus when it's called an umbilical hernia, through your groins when it's called as a groin or inguinal hernia, or it can be due from a previous surgical scar, incision, when it is called as an incisional hernia. Now what are the common symptoms? Usually it's a painless swelling that protrudes, and it tends to become painful as it goes for some time. And it can also become in a condition where it's difficult to push it back inside when it becomes a surgical emergency or a strangulated hernia. Now hernia is a very benign condition in that we can go in for an elective surgery and repair it without going into complications. Now how do we diagnose it? It can easily be diagnosed by a clinical examination or rarely by an ultrasound or CT in rare cases. Now how do you manage it? So since it's a defect, basically in a surgical repair, we tend to repair the defect and place a mesh over the defect. And this can be done both in the traditional open surgical method or by a laparoscopic approach. Now how long would you require to be staying in the hospital? It's a day case procedure, and a patient can be admitted in the morning and discharged by evening once the surgery is over. Now post surgery, the patient will require at least 10 to 14 days to resume his normal day-to-day activities or work, and he should refrain from lifting weights for a period of 6 to 8 weeks. So the final take-home message is that hernia is a very benign and common condition, and it should not be something that should be neglected. Meet your surgeon at the earliest so that we can electively plan a surgery and deal with it. Thank you.